Welcome to What's Now. I'm your host, Christine Napier. This is a show where we keep you updated on research, trends, products, things that people are talking about in real time. In fact, today's episode is all about your health and something fun to watch, the return of a reality series. Up first, though, we are going to focus on COVID vaccines. What do you need to know right now, as so much is changing about immunity and all of the different variants? Well, I spoke with a physician recently. Here's more.
The amount of currently available vaccine information can feel overwhelming, especially when it comes to COVID-19, new variants, and evolving guidelines. So, what does the medical community see as the most important information for you to know about vaccines and immunity? And what key information should you understand to protect our communities and loved ones? Dr. Marie Elizabeth Ramas, a family physician based in Nashua, New Hampshire, is joining us this morning to discuss how we can protect ourselves and our communities against COVID-19. Thanks for being here, Dr. Ramas.
Thanks for having me.
Many people may still misunderstand the primary purpose of vaccines, even though it's possible for vaccinated people to get COVID-19. Why, for you, is it still important to tell people to get vaccinated if they are eligible?
Well, the vaccine is doing its job. The primary purpose of getting vaccinated is to reduce the risk of severity of symptoms, hospitalizations, and to reduce death by COVID. And that's exactly what's been happening. The most cases that we have right now of hospitalizations are from those who have not been vaccinated fully. And so it's absolutely important to get your vaccines and get fully boosted.
If people who are vaccinated and even boosted are still testing positive for COVID-19, well, some people are wondering what the point is of the vaccination. So what would you say to those people?
I understand. My patients are tired. We want to get back to some semblance of normal. And what I just encourage them is that the vaccination is the way to get back to a new normal. What the vaccination does is that it helps us to prevent spread of illness. It helps us to reduce our time of being sick if we happen to get positive with COVID-19. And it also protects us from new variants to come. And so we need to make sure that we're doing all that we can to protect ourselves and our loved ones from now and also for the future.
We're hearing that people who are getting this Omicron variant have mild symptoms. So if the symptoms are more like a cold, then why should people continue to take the same preventative measures as earlier in the pandemic?
I really wish that this was just a cold. But honestly, what we're seeing is that although generally Omicron does have less severe symptoms than the Delta variant, we still aren't clear about the long-term or long COVID effects from Omicron infection itself. Additionally, the Omicron variant is much more contagious than its previous predecessor, and that has caused a lot of strain to our hospital systems, as well as for our pediatric population, where unfortunately we've had the most deaths and most hospitalizations in our pediatric group than before. So it's very important that we get vaccinated to protect those who are most vulnerable and also to reduce that overall swell of need from a hospitalization standpoint.
How can people build immunity against COVID-19? And if you've had COVID-19 in the past, are you immune to new variants?
Yeah, so immunity is just the body's way of protecting itself from new infection after being exposed. And that can happen both naturally by getting sick, or you can have the vaccine and provide immunity that way, or a combination. So for those that have been infected or have had COVID in the past, what we do see is that there is a measure of immunity, but it doesn't last and it doesn't protect against new variants that come along. With the vaccination, however, when fully vaccinated and boosted, people actually have a higher boost of immunity and they are protected from future variants as well. And so it's important to make sure that if you've had COVID before but have not gotten vaccinated, go ahead and get vaccinated and boosted to protect yourself from future infections.
And the guidelines are consistently changing. Can you break down the latest vaccination and testing guidances?
So the latest vaccine guidance right now, it says that those that are 12 years old or older can actually get the Pfizer and Moderna vaccine series, as well as a booster 5 months after that second dose. Now, for those who did get the Johnson & Johnson one and done vaccine, you can also get boosted with Pfizer or Moderna 2 months after your dose. That has been shown to help reduce severe infection, reinfection rates, and hospitalizations. Luckily, as well, our children ages 5 to 12 can also get vaccinated, and it's recommended that they go through a two-dose series with Pfizer as well. Luckily, we'll be able to have protection of our kids, protection of those frontline teachers that are also taking care of them, and those that love them as well.
And where can we get more information?
It's definitely important to get trusted information. So besides talking to your trusted medical advisor, like your family doctor, go ahead and check out familydoctor.org/vaccines, and you can get the most up-to-date information on COVID-19 and how you can help contribute to a community of immunity.
Well, thank you so much, Dr. Ramas. Really appreciate your time today and breaking down this important information we need to know about COVID-19 vaccines, variants, and guidance and testing. I appreciate your time today.
Thank you.